We have week 10, controlling the growth. So you'll notice at chapter 21, control of microbial growth, your mini session is already up. I put the link in the chat. Don't forget to check it out. Let me know if you have any questions, something that wasn't clear, so that I can explain it for you. This evening, we are looking at emerging, reoccurring, and reappearing diseases. We have 10 poll questions, true and false, multiple choice. And with the multiple choice, I grabbed the two most choices that were picked. So with the multiple choice, you'll only see two options, and those are just the two that are normally picked. Okay. And then we're going to wrap everything up. With that, I also want to remind everybody that all assignments are due by Sunday, 11:59. I do your professionalism scores on Mondays because everything is due by 11:59. So just keep that in mind. But let's get into the learning objectives. With everything that we've done over the last 9 weeks, can't believe it's already 10 weeks, but everything we've done over the last 9 weeks, we've talked about key terms. We're going to look at the concepts, we're going to compare them, we're going to contrast emerging, reoccurring, reappearing diseases. We have to look at pathogens because this is microbiology for the surgical technologist. We're going to look at causes associated with development of antibiotic-resistant microbes and how can we reduce the transmission. By the end of this, I want you guys to be able to critically think about this information. Now, in 2014, two Dallas nurses contracted and survived Ebola. Okay, now that's big. After treating a patient who had traveled from West Africa, the first nurse later sued the hospital, claiming it failed to properly train staff on handling high contagious diseases. But I also want you to think about something. It's not like America had experienced a disease with such a high mortality rate as Ebola. Okay. Now, this highlighted the importance of effective training and consistent use of PPE. In the operating room, you may not know a patient's health status. So always assume that every patient carries an infectious disease. And it's not because we're like, oh my gosh, this patient's going to infect me. No, it's just to protect us. Okay. And protect them as well. It's important to know how to use PPE, how to use it properly, and commit to wearing it every time during surgical procedures to protect yourself and others. And we know that we're going to wear our gown and gloves, right? But it's remembering your eye protection. I cannot tell you how many times where you are like, oh, it's not going to be a crazy case. And the next thing you know, you see somebody at the eye wash station washing out their eyes because something has gotten into it. Okay. So having that eye protection on. I tend to double glove. Working in a lot of orthopedics and trauma cases, it's just my security blanket. Not saying that I can't get a needle stick, but it's just an extra added protection. When you're doing scope cases where we're using a lot of water, I wear shoe covers. Need the ones that come all the way up to your knees, just for again added protection. And I don't like my scrub hands to get wet with all of the fluid coming from the field. Okay, now microbes in the media. Global health crises like the 2014 Ebola outbreak and the COVID-19 pandemic that we all remember have exposed weaknesses in the healthcare systems and also highlighted important lessons. These events placed immense pressure on healthcare providers addressing supply shortages of PPE and equipment while still managing the large amounts of patients. We look at emerging diseases with global travel and trade, new diseases like Ebola and COVID-19, they're going to be able to spread quickly. Reoccurring diseases, these are going to be outbreaks from contaminated food, preventable STIs, and poor lifestyle choices unfortunately still continue. Previously controlled illnesses like measles have resurfaced due to misinformation and declining vaccination rates. We hear of hemorrhagic fevers and such as Ebola. They remain global threats, and new viruses like the one COVID-19 and their variants pose significant risks. These trends stress the importance of vaccination, public health trust, and readiness just to address emerging pathogens. Now, viruses constantly mutate and evolve just to survive, often causing gradual changes in their human host cells. When mutated viruses jump from animals to humans, they can spread worldwide, especially when modern global travel. This allows one localized infection to become a global threat. Viruses are often a balance and they have an ability to spread with their severity. Remember, that's virulence, favoring strains that can affect more people over a longer time. For example, viral hemorrhagic fevers. This is the most common example, and it includes dengue, Ebola, Marburg, and Lassa fevers. These are all caused by viruses that lead to severe bleeding and organ damage. So let's take a quick look at this 2-minute video on emerging infection, and it's like a micro learning. The channel is pretty cool. So if you haven't subscribed, this is one that I actually do enjoy. But let's take a look.
Our topic today is on emerging infectious diseases. In recent years, we have witnessed the outbreak of several deadly diseases. These diseases pose a threat to public health worldwide. One such example is the Ebola virus outbreak in West Africa. It claimed thousands of lives and caused panic around the world. Another example is the Zika virus outbreak. It spread rapidly throughout the Americas and affected thousands of people, especially pregnant women. There are also diseases like COVID-19 that emerged in 2019. It has become a global pandemic, causing widespread illness, death, and socio-economic disruption. Why are we seeing an increase in emerging infectious diseases? One reason is the constant interaction between humans and animals. Deforestation and urbanization are bringing humans closer to wildlife, increasing the risk of disease transmission. Global travel and trade also contribute to the spread of diseases across borders. The changing climate and environmental factors play a role as well. As we encroach upon natural habitats, we disrupt ecological balance, making it easier for diseases to jump to humans. Rapid urbanization and overcrowding in cities create a fertile ground for diseases to spread. Farm animal practices, like factory farming, also increase the risk of zoonotic diseases. Early detection and surveillance are crucial in containing emerging infectious diseases. Efforts are being made to develop new vaccines and therapeutics to combat these diseases. Improved public health infrastructure and surveillance systems are necessary to respond effectively. Education and awareness campaigns play a crucial role in preventing the spread of diseases. Personal hygiene practices, such as frequent handwashing and proper food handling, are essential. We must also address the underlying factors that drive the emergence of these diseases. This includes addressing deforestation, climate change, and unsustainable farming practices. Collaboration between governments, international organizations, and communities is vital in combating these diseases. By working together, we can mitigate the impact of emerging infectious diseases and protect public health. Thanks for viewing this video and don't forget to subscribe for more updates.
That was a quick 2-minute breakdown by Biotech Whisper. That is the name of their channel. All right, let's break some of these down. Ebola, hemorrhagic fever, or EHF. This is a deadly virus disease affecting humans and primates caused by a filovirus with long thread-like structures, is what you kind of see on the screen. The virus replicates extremely quickly, destroying host cells and spreading through the blood to multiple organs, leading to severe tissue damage and necrosis. So, some of the key factors: uncontrolled bleeding. It occurs in your mucous membranes, your abdomen, and your heart. You have loss of blood volume, causes systematic shock, respiratory failure, and often death. Ebola is linked to fruit bats, and it's a natural reservoir in endemic regions. Now, it's important just to understand the progression and the impact. It has an importance of a contaminant, and it's really important to early intervene. Okay. I didn't put any pictures up of someone suffering from Ebola, but you can look it up. It is not, um, it's tough. Okay. There was a movie that was out about it that I wanted to watch, and I was like, I had to turn off because it was real. Now, with the filovirus transmission, diseases like Ebola and Marburg, they spread through close contact with infected body fluids. So that means that caretakers, healthcare providers, they're going to, or we're going to be at risk without proper PPE and strict contact precautions. Again, rapidly spreading through the body and body fluids. Marburg hemorrhagic fever is related to Ebola. It was first identified in 1967. It appeared healthy but infect primates and humans, so they may look kind of like they're okay. The host, think of a bat. It causes high mortality rates. Dengue fever, I know we've heard of that one. It's caused by flavivirus transmitted by mosquitoes. Severe muscle and joint pain. They have what's called break bone fever, high fever, headaches, rash, and low blood and platelet counts. There are four serotypes, and the infection with one does not protect you against the others. All right. You have severe forms of dengue hemorrhagic fever, or DHF, and then dengue shock syndrome, which is DSS, with a 50% death rate in DHF cases. So that's 1 in 2 people. All right. It affects 400 million annually with 40,000 deaths. Lassa fever. This is a viral disease caused by a member of the, see if I can say it right, Arenavirida family. And it's named for its sand like surface appearance. It's transmitted to humans through the contact with rodents, which are unfortunately natural carriers. So, some of the symptoms: fever, fatigue, affects muscle symptoms. They may have some type of gastrointestinal issues going on, abdominal pain, nausea, vomiting, diarrhea. They may have a sore throat, a cough. They may have pericarditis and hypertension, confusion, seizures, encephalitis, and meningitis. Lassa fever has a wide range of symptoms, as you can see, and it highlights the need to carefully diagnose, and robust infection prevention needs to be put into place, especially in regions where the rodent vector is common. Hantavirus. Two serious diseases. We have hantavirus pulmonary syndrome, HPS, found in North and South America, and Sin nombre virus, SNV, is the most common strain. It's transmitted by deer mouse in their urine, or the feces in rodent invested areas. So if there's a lot of deer mouse around, you want to be careful. The symptoms: flu like initially, fever, muscle ache, chills, and then you have a progressing to like your lungs starting to fill up. You have rapid respiratory failure, and then death occurs in about 2/3 of the cases. And then there's hemorrhagic fever with renal syndrome, HFRS. Again, signs: fever, muscle ache, skin, pedigae. You have gastrointestinal bleeding, pulmonary edema, and then acute kidney failure. Fatalities result from shock and then just a lot of severe blood loss. There's also Chikungunya virus. This is found in the Americas, the Caribbean, Asia, Brazil, and it accounts for about 90% of cases, again, by the mosquito. Symptoms resemble dengue fever, meaning like they'll complain of fever, joint pain, headache, rash, fatigue. Now, a CDC non-fiable disease in the US. That's what it is now. Okay. It's a CDC not fittable disease. Zika virus. This was first identified in monkeys. Pregnant women at the time, it was a big thing. Like if you were pregnant, you had to be careful because you didn't want to get Zika, because it does affect developmental growth, embryo. Okay. And then, of course, the fetus. There is neurological risks, neuropathy, myelitis. Um, and then the spread of this particular disease highlights the need of just vector control and public health awareness, especially in the affected regions. There are other viral infections. We have the Middle East Respiratory Syndrome, or MERS. It is a coronavirus causing sporadic outbreaks. Primarily affects the respiratory system with severe cases leading to pneumonia and death. There's enterovirus EVD68, affecting mainly children, especially those with asthma. It causes severe respiratory systems or symptoms and has been linked to clusters illness. There's also acute flaccid myelitis, AFM, a rare condition in children causing sudden weakness in one or more limbs. Now, it's possibly linked to EVD68, but nothing is confirmed. And then now we hear about all these different variants of COVID-19, Delta and Omicron, extremely transmittable and deadly. The thing is, research is continuing on the impact of all these new mutations. Now, these infections underline the importance of surveillance, prevention, and research just to mitigate future outbreaks. In the hospital, you're always hearing about healthcare associated infections, right? Because we do not want our patients to become infected. Now, this is when they get a disease, an infection in medical care's supervision. These infections are preventable and have gained attention from organizations like the Joint Commissions and CMS, which holds providers accountable for the high costs and the risk that they pose. Despite efforts to educate healthcare workers, HAIs remain a leading cause of preventable deaths nationwide. And I will repeat that because you may see it again. HAIs remain a leading cause of preventable deaths nationwide. We, as surgical techs, play an important role in reducing these infections, especially in high risk areas, like when we're doing central line associated bloodstream infections, when we have anything related to a catheter, right? We're trying to lower catheter associated urinary tract infections. You know, we do not want SSIs. Like, who wants to be associated with a surgical site infection? Um, and we're also trying to make sure that we are cutting down the amount of ventilator associated pneumonia or VAPS. Preventing health care associated infections or healthcare associated infections requires a collaboration among all healthcare members to identify the risks, improve infection control practices, and implement protection measures, ensuring patient safety. Now, the CDC identifies specific bacteria and viruses most commonly causing HAIs. The chapter talks about antibiotic resistance, and you have an exercise that you're going to be talking about this. Antibiotic resistance plays a major role in these infections and is exacerbated by inappropriate antibiotic use. Half of all antibiotics are misprescribed, meaning the wrong type, the wrong dose, or just unnecessary. Antibiotics in agriculture, meaning that you have low dose antibiotics in food. Animals promote growth but contribute to resistant strains of bacteria like salmonella. Resistant pathogens can transmit between individuals, increasing their prevalence in healthcare and community settings. We just have to be vigilant about infection control and understanding the impact of antibiotic resistance to help limit the spread of dangerous pathogens. Now, Table 22.1 is a 2019 antibiotic resistant threats in the United States. Now, the report by the CDC highlights the significant impact of antibiotic resistance on public health. So, some of the findings, CRE is resistant to last resort antibiotics, causing severe infections with high mortality rates. C. diff, often linked to antibiotic use, causing gastrointestinal infections with significant morbidity and mortality. Going down a little bit to MDR TB, tuberculosis, that does not respond to standard treatments, requiring longer and more complex therapies. At least 2.8 million people in the United States get infected with antibiotic resistant bacteria each year. There are 35,000 deaths that are directly linked to these infections. Antimicrobial resistance increases healthcare costs. And that's because your patients are staying in the hospital longer and they're requiring more intensive treatments. So the report emphasized the need to improved antibiotic stewardship, infection control, and public awareness just to address the growing threat of resistant pathogens. With that gastrointestinal virus, norovirus or rotavirus, both belong to a Calciviridae family, which are a major cause of gastrointestinal infections. These viruses are transmitted through food sources, contaminated surfaces, person to person contact, and they have a high contagion. Only 18 viral particles are needed to infect another person. There's a thing called fecal shedding. Infected individuals continue shedding billions of viral particles in their feces for up to 2 weeks after symptoms have resolved. Poor hygiene, including proper hygiene, I should say, not poor, proper hygiene, including frequent hand washing, sanitation of surfaces, is going to be important to prevent the spread of these highly contagious viruses, particularly in our healthcare settings. We get foodborne infections, okay? E. coli, salmonella, listeria, vibrio. These infections can be linked to various food sources, including processed, packaged, and frozen foods, and are often recurring concern in both local and global health. Now, proper food handling, you're going to hear this a lot, proper storage and sanitation are going to be important to prevent contamination and the spread of these pathogens. The chapter talks about human immune deficiency virus. It continues to this day to be a significant global health concern. The disease it causes is acquired immune deficiency syndrome, or AIDS, where there are severely weakening the immune system. So we think about transmission only through intimate contact, sexual fluids, blood, not casual contact, not brushing up against anybody. That's not going to do it. Non-transmittable through casual touch, through tears, sweat, saliva, mosquito bites, water, air, or even sitting on a toilet seat. For us, we think about needle sticks, right? But I want to kind of reassure you that while rare, 1% healthcare workers are going to take precautions just to avoid needle stick injuries, which could result in blood to blood transfusion or transmission. In the surgical setting, it's important to handle sharp instruments. You guys are gonna be dealing with hypodermic needles. You're gonna be dealing with knives, retractors that are extremely sharp. So you want to carefully handle them just to prevent accidental injuries that could lead to transmission. And don't worry, we're going to show you how to do that properly in the lab so that when you get to your clinicals, you're good to go. Now, some diseases that were previously under control or eradicated in the United States are making a comeback due to factors like anti vaccination sentiment and misinformation. The chapter talks about notable diseases, which include measles, whooping cough, or better known as pertussis. These preventable diseases are causing concern, particularly with rising cases and outbreaks. Pertussis, for example, is caused by Bordetella pertussis. It results in serious respiratory inflammation, especially in infants. There is a huge vaccination debate, all right? The resurgence of these diseases has sparked debates about parental rights, public health, and the responsibilities of citizens and the medical community. So, in response, the CDC has launched campaigns to address the spread of misinformation and emphasize the importance of vaccination. Vaccines for diseases like pertussis are available and recommended for children starting at 2 months of age. Yet, these infections are still occurring, highlighting the importance of maintaining vaccination coverage. Now, figure 22.9 talks about the 2021 recommended immunizations for children from birth to 6 years of age. Now, the CDC recommends the following vaccinations that you can see, and it protects against a range of serious diseases, as you can see in figure 22.9. Figure 22.9b are the vaccine preventable diseases and the vaccines that prevent them. Vaccines help protect against a variety of serious and potentially life threatening diseases. These vaccines are important for preventing that spread and ensuring both individual and public health. You'll also notice that as we are coming to the conclusion, our chapters have gotten a little bit smaller. So, what we're going to do now is we're going to have a class discussion activity. We're going to bring everything that we have looked at in this chapter and kind of think about it. All right, so let me start and then we'll get into the two questions. And there are how many of us? Okay, there are 12 in here. All right. The phrase, too much of a good thing, is particularly relevant when it comes to the use of antibiotics. The primary risk factor for antibiotic resistance is overuse or misuse, which presents a significant challenge for healthcare providers. They must balance the need to effectively treat infections while also being responsible stewards of antibiotics to prevent further harm. Additionally, healthcare providers must develop strategies to manage newly emerging, reoccurring, and reappearing diseases, many of which should have been eradicated without contributing to the growing issue of antibiotic resistance. Now, let's get into the questions, okay? What are the factors that can lead to the development of antibiotic resistance? You guys can either unmute or you can type it in. And keep in mind, if you have your Google open, you can look what are the factors that lead to the development of antibiotic resistance. I have one can be an incomplete course of treatment, like people who didn't finish their full course of antibiotics, most definitely. Adaptation to the antibiotics, most definitely. Great answers. What others can you find? What are you looking at? Okay, overuse of antibiotics. Yes, definitely. Definitely one. And you could type in yes or no. What about using leftover antibiotics or taking someone else's? Could that particularly, could that potentially cause an antibiotic resistance? Use of, yes, most definitely. Overuse or of it in agriculture, overdose. Yes, definitely. Um, Another one, just poor infection control, right? Inadequate hygiene, someone not properly washing your hands. And I'm going to tell y'all now, y'all are going to see some stuff and you're going to be like, ew, right? It's going to just make you want to scrub even more. So, definitely great answers. All right. Question number two. There are four questions, just so you guys know. So, question number two: which classifications of diseases would be described as emerging, reoccurring, or reappearing diseases? So, what I want you guys to do is type in a emerging disease, and I just want you guys to pick one. I don't want you guys to all kind of pick emerging, recurring, and reappearing. I want each one to kind of pick one and describe whether it is emerging, recurring, or reappearing. Okay. It can be COVID, Ebola, measles, pertussis. Just Google and let's see what everyone comes up with. And if someone else has yours, if someone puts it in first, try to find another one. MERS. Okay. So for MERS, which one is it? Is it emerging, recurring, or reappearing? Emerging. Good. Good job. Measles, recurring. COVID-19, definitely emerging. Um, Mine is Ebola, which is emerging, unfortunately. Dengue fever, reemerging. Tuberculosis, reappearing. Malaria, reappearing. Chickenpox, you guys. Chickenpox is reappearing. West Nile virus for West Nile. What is it? Emerging, recurring, or reappearing? And I didn't realize that if you had chickenpox as a child, as you get older, yes, most definitely, West Nile is emerging. As you get older, you don't get chickenpox anymore, you get shingles. You're just like, wow. So there is that. Okay, right? It didn't occur to me, like the connection. And I'm like, I had chickenpox as a kid. Does that mean I have to get the shingles vaccine when I'm older? But here we go. All right. Now, how can patients take measures to positively influence and advocate for their own health and well being in healthcare settings? There are no wrong answers. Put yourself as the patient. Like, how would you be able to advocate for yourself? Because remember, we are those patients' advocates. So sometimes it takes us just getting outside of our comfort zone and thinking about simple things that we can do. I'm going to give you guys one example and you guys can kind of go from there. Staying informed, doing your own research. I'm one for trust and verify. Like, I'll listen to what someone says, but I'm going to go ahead and do my own research just so that I'm informed, so that I am comfortable with the decisions that I make for me and my family. What other ways could you be a advocate for your own health and well-being? And again, there is no answer, no wrong answers. This is one that I want you guys to kind of self preventative care. I love it. Asking your physician or specialist, watch what you eat. That's a big one, especially with the holidays coming up. Ugh. But definitely ask a lot of questions. Bring someone with them who they are comfortable with and trust. just being active in the conversation as well as listening. Keep a journal of symptoms, side effects, etc. I love it. These are all excellent, excellent, excellent. Advocate for newer vaccines like the COVID vaccines. I like that. And do your research on which ones, right? Health education, learning about conditions that are options and preventative strategies. You guys, I'm loving it. I'm loving it. All right, last question before we get into the poll questions. What are factors that should be considered within the United States healthcare system? I'm gonna go ahead and launch it for you guys. Um, the healthcare system that would ensure better preparation, better preparedness in dealing with emerging diseases previously associated with other countries, as well as domestically recurring and reappearing diseases previously thought to be eradicated. So this one's kind of complex, right? Because as we become more linked, we are, what's the word? We're more connected, right? It's a lot quicker to get from here to, let's say, Japan to Europe, right? We're more connected. So a lot of the things you guys were saying before is staying educated. If you're going into an area that's known for one particular disease or virus, protect yourselves. When we were deployed, one of the things that we had to do was give everyone anthrax. That shot is horrible. It's a series. And smallpox, because of the location we were going to, had a higher prevalence of either anthrax or smallpox, depending on which deployment we were going on. And so that was one of the ways that we, especially on our ship, was able to kind of just give ourselves just a little bit more protection. Okay. Now, this one is a rhetorical question. So, something I just want you guys to think about, that very last one, number four. Just want you kind of think about it. All right. Now, for those of you who are watching the archive, there are 10 questions. Okay. You will be able to see these questions. I'm going to put them in the announcements in Moodle. And you'll be able to see the exact same questions that those who are here this evening are getting. You're going to get that fresh look, all right? With these questions, I just want you to use them as an additional resource, okay? Next week is your final. I will be sending out a reminder link to the study guide if you hadn't been able to locate it. It is starred in the top of your announcements, but I want you to be able to still have additional resources, okay? And I'm going to be doing that for both 200 and 210. So if you get another email from me, you do not have to Moodle message from me. You don't have to respond. This is just me letting you know here are the links to these study guides, okay? We are going to let everyone who is here this evening take the poll questions, and then we'll be back with our wrap up. Okay, so everyone that is here, they have seen the questions, and like I mentioned, you guys will get a first look at the same questions that they received, minus the answers. But they will be on announcements, and again, I highly encourage you to use it as an additional resource. Now, in our live session this evening, we discuss key terms related to emerging, reoccurring, and reappearing diseases. Emerging diseases are newly identified or rapidly spreading infectious that were not previously recognized. Not saying they weren't there, but they weren't recognized, like COVID-19 or Zika virus, and are typically associated with new or mutated pathogens. Reoccurring diseases are those that repeatedly appear in specific regions or populations, like seasonal influenza or dengue fever. Reappearing diseases are those under control or eradicated, but are now resurfacing, like measles or pertussis, whooping cough, often due to factors like people just being scared to vaccinate. We identified the pathogens linked to these classifications, including viruses like Ebola and bacteria like Salmonella and E. coli. We also examine the causative factors behind antibiotic resistant microbes, such as overuse and sometimes misuse of antibiotics in healthcare and agriculture. We also discuss the significant challenges in reducing the transmission of preventable diseases in healthcare settings and communities, emphasizing the importance of strict infection control practices and public health education. We ended up applying our thinking to just understanding how these issues relate to our environment in the operating room, where the use of PPE and infection prevention protocols are so important, and how all of these impact concepts on a broader global community, and how it's important in just managing disease outbreaks and ensuring public health. What questions do you all have for me? Well, while I'm waiting, for those of you who are watching the archive, I have a few questions for you that we're going to discuss. How can healthcare systems balance quick responses to emerging diseases with long term prevention of recurring ones? How can surgical teams better prevent the spread of antibiotic resistant pathogens? And what are the ethical challenges of vaccine misinformation, and how can healthcare professionals address it? We're wrapping up today's week 10 session, and I just want to remind you guys to stay focused and diligent as you prepare for next week's final exam. You guys got this. You have the information. If you have any questions, or you just need a little bit more clarification, I don't care if it's from week 1, week 3, week 6, do not hesitate to reach out. I am here to support you every step of the way. I am wishing you all a safe and productive rest of your week. Please have a wonderful rest of your evening. Be careful this weekend. And I look forward to everyone who can attend our final live session review next week. Good night, everybody.